Hi everyone, Dr. Omi from Pain Free and Fit. Today, a great lesson on the most important exercise to do if you have a short leg that's aggravating your lower back pain. Hope you enjoy. So there's a lot of people with short leg syndrome that have an aggravation to their lower back pain because as they stand and as they walk, one side of the pelvis is higher than another, and that causes a curve and an asymmetrical stress into discs, facet joints, sacroiliac joints, spondylolisthesis pain, disc herniations, and such. One of the most important things people should know is an exercise to help to correct the typical mechanical problems that result from having a short leg. Now, when we're talking about a short leg, we're talking about a true anatomical short leg, not a functional short leg. There is a difference. An anatomical short leg means that either the thigh bone, the femur, or the tibia, the shin bone, is actually shorter, and that causes one side of the pelvis to drop down when you stand and walk. A functional short leg is not a true shortness in the leg, but due to pelvic malalignment problems, such as having one side of your pelvis tilting backwards and the other side tilting forwards. That's going to create a long leg on the side of the pelvis that tilts forward and a short leg on the side that the pelvis tilts backwards. That, once you manipulate or create a corrective exercise regimen that helps you restore normal pelvic alignment, will equal the legs out. So that's not a true leg length deficiency, which is what this exercise is based on. If you're not sure of the difference, go to your local chiropractor, osteopath, physical therapist, or orthopedist and have your legs measured, have an Alice test done, have an actual measurement done on your thigh and your shin bones and check your pelvic alignment if you truly have a true anatomical short leg, which is what this exercise is for. So, with that being said, let's say I have an anatomical short leg on the right side. Either my femur or my tibia shin bone is short. As I walk and stand, this side of my pelvis is lower, and it creates a compression on the opposite side. The most important thing to do is to address not only with a heel lift, so you're going to try to equal out those legs artificially so you're no longer aggravating asymmetrical stress into your disc herniations and bulges, spondylolisthesis, stenosis, sacroiliac pain. You want to try to even out with a heel lift so that your legs are level, but to create a corrective exercise pattern in the typical most important problem due to the short leg, which is the hip abductors. When you have a short leg on one side, let's say my right leg is short and that pelvis drops down compared to the other side has a tendency, when you're standing and walking, to have a hip hike, meaning the hip elevates up into the rib cage and it also slides to the side. There's a lateral translation. So if you look at yourself standing or walking, what you'll notice is the side of the long leg, you actually have a tendency to lean your hip that way a little bit and to hike it up. What this does is it sets up a perpetual pattern of weakness of the hip abductors, the glute medius. And that perpetuates lower back pain, especially sacroiliac problems, facet joint problems, disc problems, and such. So the corrective exercise is learning how to engage that hip that usually moves forward and up, down and in. So standing simply on one leg, you can hold on to something for balance. Standing as tall as you can by pushing that hip down and in will help to level out your pelvic bones. And if you hold this isometrically, you're going to notice the hip starting to work, that hip glute medius muscle. Once you get good at this and you can hold that for a couple minutes, you can progress to doing a slight maneuver where the knee is bent and the hip moves backwards, like the beginning of a one-legged squat. As I put my hip back and bend my knee a little bit, I can practice avoiding the tendency for that hip to move sideways and up by pushing it down and across. Again, you'll feel not only the glute medius in the hip, but you may also feel tension in your ITB complex. Finally, this exercise is progressed once you build that up and your ability to hold that to one-legged squatting, where you stand on one leg, especially that leg that's long, push the hip down and in, and maintain that position as you do a one-legged squat, avoiding the tendency of having the hip move sideways and up, especially the deeper you go. So as you come down, you're going to need to keep pushing that hip down and in to keep it level or even a little bit lower than the opposite side. Practicing this over time is going to help to develop the glute medius, your anti-hip hike ability. It's going to help train pelvic symmetry and go a long way, even if you put a heel lift in your shoe to restore the normal biomechanics to your lower back and hip complex and prevent aggravating your disc, sacroiliac, spondylolisthesis, facet joint, low back pain. If you like this video on short leg syndrome and corrective exercises, check out our channel. We got a lot of great videos to help with lower back pain. If you're looking for a program to customize a healing exercise program to help with your SI, sacroiliac, with your stenosis, with your spondylolisthesis, with your disc herniation, degenerative disc disease, check out our programs at painfreeandfit.com. They're all based on a unique analysis you do on your own body and learn how to correct your exercises with tailored corrective movements that will help you avoid lower back pain. I hope you enjoyed this video on short leg syndrome and low back pain with corrective exercise.